Well, at first when I heard that we were switching health plans, I could only imagine the obstacles. I fought them. I was very fear of what it would turn out to be because of what we would have to pay. Everybody doesn't like change. No one likes change, actually. So when you hear change and you hear change about your healthcare provider, it gets very sticky really quick. So I was in fear of what we would run across. But after I started understanding it and not fighting it, it is an awesome plan. Well, if people do not realize that we are assigned a nurse navigator specifically to our group. So she has been my lifeline, actually. I wanted to, of course, everybody wants to conquer this themselves. And when it comes to healthcare, it's complicated. So your nurse navigator makes that a whole lot simpler. From your medications to your specialty doctors, all the information is out there for you. All you have to do is reach out and they give it to you. So they are there to be a resource to you and a resource that's very, very helpful. All we have to do is use it. So you fight the fact that you're changing a primary care doctor. You've used this doctor, say you use the same doctor for 5 years. You're like, oh my gosh, because here we are again, we have change. So when I reached out and established with our primary care doctor for the new health program, guys, these doctors talk with you directly. You're not going through somebody else. You're not jumping hoops. You don't have to talk to a secretary of a secretary of a secretary to actually talk to the doctor. The doctors take their time. They listen to all your health concerns. They answer your questions. And after you leave the office, they email you directly. You have a lifeline directly to your doctor. I don't care what anyone says, guys. You don't have that anywhere else. Nowhere else is that available. We've had our doctor email us on the weekend if we have a concern and we send a message. She messages back. We've had emails come through as late as 10 o'clock at night. You do not get that anywhere else. Absolutely not. One of my major concerns had to do with our medications. My husband and I both have a couple of specialty drugs that we had set in place. And again, you get very, very scared when you start changing stuff around. Like you can't be without this for X amount of time or whatever. So again, I reached out to the nurse navigator and listed those specialty drugs to her. And then she told me how it needed to go about, how to process it. And guys, we pay absolutely nothing for those specialty drugs. All you have to do, again, you have a lifeline. It's a nurse navigator. Reach out to them. They can tell you exactly how to get those drugs. Another concern that we were going through was our specialty doctors, is that I call them. When you're looking at a specialist, some people that scares. Of course, you have to have your recommendation or your referral from your primary care. Again, your primary care is amazing. They will refer you to those doctors, but if you're curious as to where you can go see one of those doctors, if you need a renal doctor, a cardiologist, whatever that specialty is, again, just reach out to your primary care doctor, which is, again, available 24/7, literally. Tell them what you're needing, who you would like to see. They'll send that referral. And it's really just that easy. We make it complicated when it's truly not complicated. And when you stop fighting it and reach out to your resources, you will truly enjoy your new healthcare coverage. One of our concerns were surgical procedures. As we get older, we fall apart. We have to have things done. Those costs are astronomical. But again, if you have your primary physician refer you to the specialty surgeon, those are paid for. And guys, that's huge. That's extremely huge. Whether it's knee surgery, heart surgery, we don't plan for those. Everybody don't have that kind of money laying around just to go out and have those procedures. And these procedures are truly covered, which is a huge financial weight lifted off your shoulders when you have to unexpectedly have a surgery like that. So we were very, very happy to know that those procedures were covered. We all know that change is hard. We like to fight change. Nobody likes change, but we all like to save money. And by fighting it, you're not saving money. Just let it flow, save money. That was our major concern. When it costs the financial world these days, the things that we run into unexpectedly. But fortunately, this plan has allowed us to have those unexpected expenses paid for. So it saves you money, and just don't fight it. Just let it go. We had to learn ourselves to do that, and it is a great plan. You have all the resources at your fingertips, and I am very, 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 very pleased with our primary care. I cannot stress to you enough to have somebody personally reach out to you, that you can actually talk to your doctor and not go through the hoops and bounds to get to them. That alone is worth the plan.